Hello, I'm here to talk to you about the 100-day programme. The 100-day programme is all about improving patient care. So doctors, nurses and healthcare professionals for diabetes, ophthalmology and dermatology services have come together alongside the patients that use those services, and they've talked together about what works and doesn't need to change. They've talked about what works but could be improved, and they've also talked about what doesn't work in those services. And over that 100 days, they've identified lots of new ideas to change services, and they've tested those ideas. And this short film now describes what they did, why they did it, the learning that they got, and most importantly, it describes the improvements for patient care.
We've worked together as part of the 100-day challenge to try and look at different ways of managing patient referrals so patients have quicker access to services. This has been done by triaging the referrals first by myself with Janet's input as needed and allocating the patient to the most appropriate area to be seen. With triaging the referrals, it meant that the patients were often seen sooner because they were seen by a nurse rather than waiting for a consultant appointment. For one particular patient, this meant that their operation wasn't cancelled. They were referred because they had poor control of their diabetes. If it hadn't been improved in a timely manner, they would have had their appointment for their operation cancelled. So we were able to see them improve their diabetes, and therefore our operation went ahead as planned.
We have done a virtual clinic with 3 GP practices with representatives from all 3 practices, with myself, Rose Coffey and Dr Srinivasan, who is consultant for Grantham District Hospital. Those clinics have actually evaluated exceptionally well in the fact that the GPs and practice nurses who were present found the 2-hour session to be really helpful. It's built closer working relationships between the 3 of us as the diabetes specialist team, but also we are now beginning to build up those relationships with our primary care colleagues.
So we are here to talk about the 100-day program. I think the 100-day program has been very helpful. Speaking from a clinician point of view, we were getting lots of patients that were being referred to us with cataract. When we were seeing them, they were not fully informed about what was happening or whether they needed surgery. So with the 100-day program, we did make a video and we had a patient leaflet as well. And what that has done is helped us to reduce the referrals that we are getting into the hospital. As a result, only people who need to have surgery, who know the risks and benefits and are keen to proceed, are the ones coming in.
Again, from the patient's point of view, the patient does not want to come and spend £2 or £3 in the car park plus 2 or 3 hours in the eye department waiting for an opinion that actually they knew they didn't want surgery in the first place. So from a patient's point of view, it's a waste of their time and efforts. By having all the information up front before their referral, they know they're coming for a particular purpose and they're happy to come and have their assessment.
When we looked at the data before the start of the 100-day program, our conversion rate was about 57 to 60%. From the patients that have come after the 100-day program protocol has been introduced, it is about 95%, which is what we had set out to do. So it has made a big difference to the quality of referrals, and the patients are a lot happier as well.
And let me tell you the background of this 100-day challenge project. There has been tremendous increase in the outpatient referral over the years, and it is believed that the outpatient referrals have doubled since 2006. In this context, this project was developed, and the idea was actually to have spot clinics see a large number of patients in less time. So what we did, we targeted a specific group of the patients which are suitable for the spot clinics. So we organized the clinics in which we had 3 rooms, and each with one nurse or healthcare assistant. And as the patient would come in, the nurse or the healthcare assistant would take the history, and then the doctor would come in and examine the patient and give information about the patient's condition and advise on the treatment. So effectively, doctor would use his time focusing on examining the patient and giving advice about his or her skin condition. So that means in a normal 4-hour clinics in the hospital, you can actually see 16 patients, and here you can see probably 30 to 40 patients at the same time. So we now plan to implement this at a bigger level, and the idea is to set up as many as possible spot clinics across the Lincolnshire. And this would actually release a pressure on the hospital. And there is tremendous pressure at the minute about the 2-week wait referrals. So those patients now can, hospitals then can easily accommodate those patients.